following program is produced in cooperation with the University of Minnesota Academic Health Center, a leader in the dissemination of knowledge. The University of Minnesota Medical School teaching tomorrow's physicians. The Minnesota Medical Foundation supporting health-related teaching, research, and service. Fairview Health Services, a world-class healthcare system, and University of Minnesota Physicians, a multi-specialty clinical practice group.
Welcome to Health Talk and You, our program about health from the University of Minnesota. I'm Dr. Jim Pacala, filling in for your regular host, Dr. Greg Versalati. Today, as you can see, we've taken our show on the road. We're here at the Wilder Foundation's Humboldt Apartments in St. Paul. The University of Minnesota Senior Health Center Clinic is also located here on campus. Several residents of the Humboldt Apartments are with us here right now, and we'll be taking their questions on our subject today, which is arthritis. People of all ages can develop arthritis. It's important to recognize the warning signs. It's also important to know that if you're diagnosed with arthritis, help is available. We'll be talking about the symptoms and treatment of arthritis with our guests, and I'd like to introduce them to you now. Dr. Gerald Mullen is a rheumatologist at the Fairview Nicollet Mall Clinic. Welcome, Jerry. Dr. Ed Chang. Ed is an assistant professor in the Department of Orthopedic Surgery at the University of Minnesota.
Thanks.
Dr. Maren Mahauld. Dr. Mahauld is the rheumatology section chief and a professor of medicine at the VA Medical Center. Well, let's get started. This is a common disease. Jerry, let's talk a little bit about the diagnosis. Why does joint stiffness indicate impending arthritis?
Well, I guess it doesn't always indicate impending arthritis because it can be related to tissues around the joint, but most of the time it does. And our job as rheumatologists is probably primarily to pick out the people that have joint inflammation related to an inflammatory disease versus arthritis related to wear down of the joint. I think that's my big job.
Well, how do you do that? One of our audience members said, can a blood test diagnose arthritis? Is that how you do it? Maren, you want to take that one?
Well, we use laboratory tests in the evaluation of patients that have joint pain and swelling. And in some cases, you can make the diagnosis with certain blood tests. And probably one of the more common ones would be gout. If you have an elevation of the uric acid in the blood and you find uric acid in the joint fluid, then that laboratory test helps you to confirm the diagnosis that gout is the cause of the pain and inflammation in the joint. One of the more recent sort of kinds of arthritis where the cause was found was Lyme disease. And since we're in the Lyme disease belt, sometimes patients come in with pain and swelling in their joints, and a Lyme titer can be very helpful if it's clearly positive. So there are a number of situations where certain blood tests are very helpful in the diagnosis.
Terrific. So you talked about a couple of kinds of arthritis, gout and Lyme disease-associated arthritis. Peggy from our audience asked, discuss the different kinds of arthritis. So we've covered gout and Lyme. Ed, do you want to discuss a couple of other types?
Well, in addition to that, arthritis mainly means an inflammation of the joint or an abnormality or disease of the joint. And there can be many types, as you said. It can be due to a traumatic injury or a fracture. It can be due to degenerative disease, so-called osteoarthritis. And then there's inflammatory types of arthritis, such as rheumatoid arthritis, or arthritis related to other diseases, such as colon or gastrointestinal diseases, or lupus. So there are many different types of arthritis, and we ought to be careful when we're speaking with a general term.
So it's sort of a large generic term describing a whole family of diseases, it sounds like.
That's correct. It's a general term. The other one I didn't mention is a septic arthritis, or an infection in the joint, too.
Well, let's talk a little bit about treatment. Maren, one of our audience members asks, are there any side effects associated with glucosamine and chondroitin use, especially long term? Why don't you tell us what glucosamine and chondroitin are first, and then a little bit about it.
We used to always say that all treatments for arthritis have side effects, but now I think this is one exception. As far as I know, there are no side effects, adverse side effects from glucosamine and chondroitin sulfate, which are really nutritional supplements that are thought to decrease pain, and the hope is that long term it might slow down the progressive destruction of the cartilage in the joints. Now, the first studies were just reported in October at the American College of Rheumatology meetings that were the first to show that there's a significant decrease in pain in patients who have degenerative or osteoarthritis.
That's the most common type.
The most common type of arthritis. So about a third of the patients noted significant decrease in the pain in that joint. And this was the first study. It was from France. It's the first controlled scientific study to show that. There are other studies that are going on now to see if, in fact, taking it even longer, maybe 3, 4, 5 years, will actually slow down the destruction of the cartilage in the joint, which, of course, would be a good benefit for patients who suffer with osteoarthritis for, the last 40 years of their life. So that it's very encouraging. And to date, as far as I know, there are no serious adverse effects.
Great. So this is new information.
Right.
Patients come and ask me about this all the time, and I've been saying, well, we just don't know. The scientific studies haven't been done, and now it sounds like there's some
Right.
research reports coming out now.
Right. There's a couple items about the glucosamine. There's nothing that really says that the glucosamine plus chondroitin is better than just glucosamine. It seems as though it's the glucosamine part of that combination that's producing the benefit. Costs anywhere between $30 and $60 a month. Health insurance does not cover that. So for the patient, it's a decision of whether or not you want to try it, because the cost is out of pocket. Mm-hmm. Some of my patients have told me if you go to your local veterinarian, though, you can get it for half the cost of what they sell it for in the food stores, because the veterinarians have been using it for years for animal arthritis, and it's the same product. So you might, depending on where you live, you may be able to get a good deal at the veterinarian.
Maybe we should get some of our colleagues from the vet school on this program. But Ed, did you have a comment about that?
Well, I was going to tell you, I tell my patients that the major side effect is probably upon their wallet or their pocketbook.
As is the case with many illnesses, unfortunately. Yes. Jerry, Betty from our audience writes, she has been told that she has arthritis of the spine, and also that her bones are thinning. So we've got, is that two separate problems, and how would you approach that in terms of treatment?
Well, probably two separate diseases. I guess the first thing I think about is, does this woman have an inflammatory disease of the spine called spondylitis, which is fairly rare because they're mainly men who have the problem, although it's possible. So I have to make up my mind as whether they have an inflammatory disease or whether this is a wear-down disease in the discs, which lose water content and wear down and then affect those little joints behind them.
Now, are both those arthritic processes that you talked about?
They're both arthritic processes, but they come about for different reasons. One is inflammation, and one is just wear down, and probably wear down particularly on discs.
So how would you approach each of those problems?
I guess I'd decide in my own mind if there was any sign of inflammation and whether this person did have spondylitis. And then if they have mechanical problems with their back, with the discs and the facet joints, then I have to figure out a way to treat that before I send them to Ed. In a way that would relieve the pain and somehow get them back on their feet. I think this has all been changed the last few years by the fact that we're discovering that some people have severe osteoporosis, which has contributed to the wear down of the vertebral bodies.
Different process.
A different process, and yet they can occur together. And we have ways now of finding them on X-ray examinations. And if we can identify it, we have, in the last 2 years, some really effective drugs.
Terrific. Well, I'm going to send the next question to Ed. Ed, one of our audience members is wondering, when a hip is replaced due to arthritis, how long would the replacement typically last?
Well, that depends a little bit on the activity level of the patient. The hip is a mechanical device. It's like your car, so to speak, and if you drive it hard, it will last for a shorter period of time than if you're more careful with it. However, in general, for someone who's in their 60s, the hip will last, 90% of the hips will last at least over 10 and probably close to 15 or 20 years. So for most patients over 60, we would hope that it would last for their lifetime.
Now, I know you've brought a knee with you today. Why don't you show us your knee? Ed is an orthopedist, and he replaces joints, and he's brought an artificial knee joint. Why don't you show us that and tell us how long that one would last?
Well, this is an artificial knee that you can see. This is not my knee, of course. And what happens in the knee replacement basically is that the joint is resurfaced, so that from the side, we take the cartilage off the bone, which has become arthritic or worn out. And then we shave that off with a saw, and then we also resurface the top of the tibia bone. And so these are covered by metal and plastic. It's a bearing surface and works much like a hinge with your ligaments connecting the two bones.
And
what you don't see here is there's a kneecap.
The kneecap goes right.
Yes, exactly. And that would serve to track along this little groove here and work with the muscle which extends your knee.
And you don't replace the kneecap, is that right?
No, we do routinely. With most, probably over 90% of the knee replacements involve resurfacing the kneecap as well.
How long is that going to last?
Well, this one will last probably about the same as the hips. And so again, in someone age 60 to 65 who has a knee replacement, we would again expect it to last their lifetime. The knee replacements and the hip replacements will be about 95% of the people will be satisfied with the pain relief associated with these operations.
That's the main reason for getting them, right, is pain.
Improving pain and joint function, yes.
Terrific. Maren, I've got another question for you. Is regular exercise good if you have arthritis?
It's probably one of the better components of the overall treatment program for patients with just about any kind of arthritis, probably except for septic arthritis. What happens when you have inflammation in the joint and the joint swells, that stretches the muscles and the tendons, and then pain inhibits the strength of the muscles, so the joint becomes very unstable. And with pain, there's a tendency to become more sedentary and do less walking, do less stair climbing. And so with the inactivity, that compounds the muscle weakness around the joint. So that, for example, for osteoarthritis, a regular walking program is one of the most effective ways to decrease pain and to decrease the risk of falls, which of course in older individuals, falls
Big
become
problem.
a major issue. And the one thing that you can do for yourself is, with a regular walking program, strengthen the muscles around those joints. It will decrease pain and it will decrease your risk of falling and ending up with a broken hip.
Can you wear down your joint even more by exercising and perhaps make things worse?
That was always the fear. So that 10 years ago, the recommendation was that it was best for people to limit their exercise. But once regular research and scientific studies were conducted, it was shown that the people who did a regular walking exercise program did not have any more rapid deterioration of the joint than those who sat. But what was more important is they had fewer complications, less pain, fewer falls, and they had a better function, quality of life if they exercised regularly.
Get out and walk.
Mm-hmm.
That's pretty much of a universal. Jerry, Peggy from our audience asks, how does nutrition help with arthritis?
Good question. We're all just besieged by people recommending all sorts of things for our diet. I think we're getting smarter as far as understanding what's in a good nutritious diet without a lot of fat and other substances. But as far as any diet that particularly helps arthritis, I don't think there really is any. A diet that's high in calcium, especially for people over 40 to 45 years of age, and in, well, younger women who are building their bone strength, is so important. And that's where families should be pushing to make sure they get enough calcium in.
What about weight? Would weight have anything to do with arthritis?
I think it does. And certainly you can wear down hips and knees faster if you're too heavy. Obesity is a major problem in the United States now. And I think we in the medical business will be addressing this more and more as time goes on, as we see more and more problems arise relating to carrying too much weight around. Enough said about that.
Great. Ed, I've got another question for you. Does chiropractic treatment help for arthritis? What about chiropractic?
Well, I guess I would like to know exactly what is meant by chiropractic treatment if one refers to various manipulations. I tend to equate chiropractic treatment as fairly similar to physical therapy and use of different modalities like heat or ultrasound or stretching exercises or pain relievers. It doesn't really do anything to change the natural history of the type of arthritis or disease that they have. I'm not aware of any study that would indicate such.
Comments on chiropractic?
I think in some individuals it helps with pain. I think for other individuals that have inflammatory causes to their spine disease, or if they have severe osteoporosis, chiropractic manipulation can be very dangerous and can result in fractures that can injure the spinal cord. So that for most chiropractors will not do manipulation on someone who has ankylosing spondylitis, for example. And certainly if you have spondylitis or if you have severe osteoporosis, you do not want to go to a chiropractor for manipulation.
Terrific. It sounds as if with most of these diseases we can describe what causes the disease and we can give treatments that can help the symptoms, but we're having difficulty finding treatments that actually halt the process of the disease, the inflammation and the wearing down and so forth. Is that right, or?
Well, I think things have changed so much in the last 2 years with inflammatory arthritis, particularly rheumatoid arthritis. We have drugs which are just miles ahead of what they were 5 years ago. And if we can give them at the right time, we're giving them earlier and earlier in the course of the disease because we think we can avoid the destruction that occurs to the cartilage, the bone, and the tendons by turning off the inflammation. That's what we're trying to do now with these new drugs, and I think it has been a big change in the last 2 years.
Right. We have the 3 new medications now for rheumatoid arthritis: leflunomide or Arava, etanercept or Enbrel, and infliximab. And with these new drugs are dramatically effective in rheumatoid arthritis, and there's already preliminary evidence that it delays destruction of the joints as you monitor that by X-ray. So we're into a new era now with the treatment of rheumatoid arthritis. It's going to decrease their business.
I'm sure that is welcomed by him anyway.
Yeah, we would be happy with that. As with the medications, there are some surgical procedures which are on the horizon that we're looking at. And by this, I'm referring to cartilage transplantation or regrowing cartilage onto the joint surface.
There's some work being done at the university about that, isn't there?
Yes, there is at the university as well as around the country and around the world. And this involves taking cartilage cells, growing them in a laboratory, and putting them back in your knee or your shoulder or wherever it might be. But there are very specific indications, and that will be tracked over the years to more precisely define which patients are candidates for this type of procedure.
Great. Marin, one of our audience members, who is 84, is retaining fluid and asks which would be the better medication to treat arthritis, Tylenol or Aleve?
At over age 65, the side effects from the medications that we call non-steroidal anti-inflammatory drugs, that's ibuprofen, indomethacin, naproxen, Aleve, those those drugs all can cause sodium retention and give edema or swelling in the legs. So if that's been a problem that's been noticed with using the nonsteroidal anti-inflammatory drugs, Tylenol or acetaminophen would be the better choice because it does not cause any sodium retention.
How about the pain relief of Tylenol? Is that as good as the other drugs that you were talking about?
For patients with degenerative arthritis, it appears as though the pain relief with Tylenol is just about the same as with a nonsteroidal anti-inflammatory drug. However, if you have an inflammatory cause to your arthritis, Tylenol will not do any good. You need to suppress the inflammation in order to get the pain relief.
And the inflammatory types would be rheumatoid arthritis and
Gout,
and some of the others
spondylitis, yes.
that we've talked about. Very good. Jerry, if you suspect that you have arthritis, should you see a rheumatologist or can a family practice doctor diagnose it?
Well, I've been given this question every year. But no, my idea is that you should see your family practice doctor, have him assess it, and then decide what he thinks you should do, or she. Because oftentimes they can make the correct diagnosis. What they want to do is label it and then give a specific treatment for it. We all work with family practice doctors as rheumatologists, and we get referrals when things aren't working out, and the problem's a little knottier, and we have to then get a different approach.
Very good. Ed, how about this one? Can arthritis progress to a disease called arteritis? Arthritis and arteritis.
Well, these are very similar terms, but different diseases. One involves the artery, or inflammation of the artery, or problem with the artery, and another one involves the problem with the joints, or arthritis. So they're very different and do not lead to each other as far as I'm aware.
Terrific. Maren, one of our audience members was interested in psoriatic arthritis, or arthritis associated with psoriasis. Could you fill us in on that?
It's a well-known sort of association that patients with psoriasis can get inflammatory arthritis that looks very much like rheumatoid arthritis in some cases, or may involve just one or two joints with inflammation and be kind of an atypical form of inflammatory arthritis. In general, we use pretty much the same medications to treat the skin inflammation as we do to treat the joint inflammation. And some of the newer drugs that we're using in rheumatoid arthritis have had very dramatic effects on psoriatic skin disease, essentially making it disappear.
Terrific. Jerry, one of our audience asks, a patient with a dry mouth asks if there are painkillers without side effects.
Well, dry mouth is part of arthritis so often. It's called Sjogren's syndrome. He was a person who described the dry eye and dry mouth association, and then it was found that it occurred frequently with rheumatoid arthritis by itself, even with osteoarthritis. What was the second part? It was about whether pain medicine causes a dry mouth?
Are there any painkillers without side effects?
Probably not, except for Tylenol. And I suppose Tylenol, if given in too large amounts, can be dangerous too.
Sure, it can cause problems with the liver, but
yeah.
That's usually what I tell my patients. I start out with Tylenol most of the time, and I try to give them as much Tylenol as I hope that they can tolerate, and that will help their pain relief. And then if that doesn't cut it, then you really have some decisions to make, right? Because there are various side effects with various painkillers.
You know, this is a kind of a current controversial area right now about the risk of side effects in individuals over 65 with using nonsteroidal anti-inflammatory drugs for pain relief. is pushing people to recommend opioid pain medications. And what we're finding is they're far safer than anybody thought they were. If you can treat the constipation before it develops.
Okay, all right. Well,
You know,
unfortunately, we're going to have to stop there because we're out of time, but maybe a topic for another day. It's been wonderful to be here at the Wilder Foundation's Humboldt Apartments with our live audience, and to be here with you, our television audience. For more information, you can call for this brochure produced by the University of Minnesota's Academic Health Center. The number to call is 1-800-235-6466, or you can email us. The email address is hlthtalk@umn.edu.
Health Talk and You will soon be kicking off its fall series of new programs. The topic of the first show will be colorectal cancer. We'll be answering questions such as, what kind of diet helps prevent colon cancer? When should screening take place? How reliable are the various tests? If you have a question about colorectal cancer, be sure to call 1-800-235-6466 and leave your question on our answering machine. We'll try to get it answered for you on our season premiere.
Thanks for watching, and we'll see you next week with Dr. Versalati.